having trouble getting into your bottom of your squat, sometimes you get down to the bottom and you can't get your knees out far enough. And part of that is that your hips don't open enough, right? So if you can't push those knees out, you're not going to be able to drop all the way down in between your squat. So one of the mobilizations we can do for that is we can take our mobility band, we're going to step through it with the leg we're trying to treat and get way up into the groin. And then I want to be perpendicular to it, so I want the band to be pulling out to my side. So I just want to get into a hands and knees position. Now this would normally kind of pull you over, so I'm just using a plate here so that my leg doesn't slide. And then from here, I can just work on shifting back into it, or maybe I just want to work on shifting my hips side to side, particularly towards the side of the band. Right? And that's really going to wind up that lateral aspect of my hip and get some mobilization to gap that space a little bit, so that way when I'm done mobilizing, I can now get into a deeper squat position and my knees can get further out. If I need to add more tension, I can move out a little bit and then just, again, pull that weight right up against my leg, so that way I can progress how much resistance I'm putting into that hip through the band. Now when I get done with that, I should notice that I get into a deeper squat because now my knees can push out further and I can get into that low position without having any pinching in the hip, pain in the back of the hip, or restricted mobility.